So my name is Nicola Di Liguori Carino. I'm a consultant hepatobiliary and pancreatic surgeon, and I've been working as a consultant surgeon here in Manchester for over 15 years now. I am part of a very large team here, made of 8 consultants, and we are just specialized in disease of the liver, pancreas and biliary tree, and this is what we do here at Manchester Royal Infirmary. So our department is one of the largest HPB units in the United Kingdom and probably in Europe. We work on a base of being a tertiary referring center with a catchment area of over 3.5 million people, which are all of those patients that rotate around the city of Manchester. We get referral from over 15 hospitals into our central HPB MDT. What that means is that we are highly specialized in treating disease of the liver, pancreas, biliary tree, and also means that all the other services working with us are super specialized in those diseases. The BOWA Fellowship is something relatively new, that it's the result of a long-standing relationship between our unit and BOWA, which has lasted at least for the 15 years I've been here, but probably even before that. We have somehow grown together, and through discussion and different ideas, 3 years ago, our relationship has culminated in the fantastic offer from BOWA to sponsorize a senior clinical fellow in HPB surgery for a year. We are lucky enough to be at the 3rd year now, and we had some fantastic experience. So this year we have a new fellow called Dr. Dimitri Voros, who is a Greek doctor who has completed his surgical training in the University of Athens, and he has been working at the University of Athens during his training in a unit which is specialized in hepatobiliary and pancreatic surgery. We got to meet him in one of the international HPB meetings a few years ago, and then he took the opportunity to come and visit us as a clinical attachment 2 years ago for about 2 months. When the BOWA Fellowship was advertised last year for the year 2024-2025, he applied, and he was lucky enough to be chosen after a competitive interview. He's involved in all the management of patients, from outpatient clinic to the ward treatment, and obviously theater. In theater, according to the level of the complexity of the operation that is taking place, or according to the knowledge and ability of each individual trainee, they will be involved in anything from emergency cholecystectomy to major cholangiocarcinoma resection, major laparoscopic liver resection or laparoscopic pancreatic resection, which is something especially that we are quite advanced in our unit in terms of minimal invasive surgery. So the aim for us is to bring someone like Dimitris and making an extremely competent HPB surgeon at the end of his placement. So if we talk about the impact that the BOWA Fellowship is having on our unit, I must say that is huge, and it's huge for a number of reasons. In a context of austerity, as it is the NHS at the moment, having the opportunity to have an extra trainee in an extremely busy unit where we do over 350 HPB resection per year, it's a major gift. And this is even more a gift if we think that this fellowship is dedicated to people who have already advanced experience in HPB. So the fellowship is bringing us someone experienced, someone who has complete her or his clinical surgical training, and it's focused on developing HPB skills. So the focus of this trainee will be all on HPB, which is what we're doing day in and day out here. It's not only beneficial to the trainee, but it's extremely beneficial to everyone around her or him, which means Patient benefits from the enthusiasm and the drive and leadership of this person. Colleagues, peer colleagues, healthcare associate that works around, specialist nurse, they all benefit from having someone so motivated working. But ultimately what we can't forget is the advantage that at consultant level we get from a person like this, because we'll spark ideas, we'll promote discussion, promote research, and keep up the motivation that all we have to keep growing and getting better and better. I wish to hope that this collaboration with BOWA will keep growing over the years, because I genuinely see this as an opportunity for us as a unit to grow. What we want is to have people coming here, training with us, having good time with us, and being able to spread the word. Having good people here and having people that one day will be not only like us but better than us is what we're here for, obviously, other than treating patients. But the motivation that we have is to be proud of what we're doing here. It would be great one day to retire for all of us and think that what we have given to people, it's teaching and ability to reproduce in the years to come what we've done so far.